about COVID because I did want to ask you about what we heard from the CDC director yesterday, talking about impending doom. And I want to know your reaction to that, number one. And then number two, what we're going to do, if anything, differently in our state with regard to eligibility for vaccines.
Right. Well, listen, we have tremendous confidence in this vaccine. Our vaccine rollout, we're now over 3 million doses in our state. It has proven to be super effective, over 95% effective. We have such a powerful thing in this vaccine that people are now getting in their arms. But we do have to understand that we are seeing a rise in some of our cases in the state of Washington, which is very concerning. And we have to understand this. Let's just dispel that, thank you. We have to understand that this is a race between the vaccine and the variants. And we want to win that race. And the way to win that race is everybody get vaccinated as soon as you can and wear a mask anytime you're in public in the interim. And we need to keep doing that. We need to be cautious around other people. And if we'll do that, we'll have a fighting chance of winning this race. But the president, on down, has made it very clear that we have to be careful while we're getting these vaccines in people's arms. As far as changes in our prioritization, we look at this on a daily basis. So we start a new tranche, so people with comorbidities today and people with disabilities will now be eligible. Some of their workforce and construction otherwise will be eligible today. So we'll be looking at this on a daily basis. Right now, the next tranche would be May 1st to everyone. There's a possibility that could move up if we have a more rapid pace of dosages delivered to us in the next 2 or 3 weeks. So there is a possibility that could move up. We have not made that decision at the moment.
Are you considering younger adults getting the vaccine sooner? We're seeing across the country 30-year-olds, more people that are getting COVID that are younger. Maybe we did this backwards. Is it time to reevaluate and consider giving the vaccine, making the eligibility, or making younger folks a priority?
No, we've made a good scientifically based decision. And as you know, we have saved thousands of lives in Washington because we made basis on science. We made decisions based on science. And the science is very clear that older people, people with comorbidities, have the vast majority of these deaths. Over about 90% of the deaths are people over the age of 60 and those with comorbidities. We have to do those people first. We want to save lives. That's our basic goal. So this was clearly the right decision. It's one of the reasons we have such a low death toll in Washington state. Now we're going to do the people with comorbidities, people with double lung transplants and cancer and the like. Clearly we need to get those people vaccinated. Now the younger folks, they need to wear masks and stop partying all night irresponsibly. And that's something that's a problem. We have an outbreak in Whitman County right now, in part because in the college community. So we're calling on the young people to help out here for the next couple months and be careful so we can keep your elders alive.